now I'd like to introduce our speaker for this evening. Karen Flores is a pharmacy resident at the Valley Hospital, and she's been with us this past year, and I'm going to let her further her introduction. Thank you so much for being with us, Karen.
Thank you so much for that introduction. So hi, everyone. So just quickly to explain like what a pharmacy resident is, I am a licensed pharmacist and I rotate through different areas within the hospital. And it's just to expand on what I learned in pharmacy school. So it's just additional training. So I would like to get started on the topic for today, and that's antioxidants and aging, myths versus facts. So what we're going to learn today is what are free radicals and antioxidants? How does oxidative stress affect our body? And what does research show about antioxidants and aging? So I just want to quickly explain how free radicals function. So free radicals attack important macromolecules leading to cell damage and homeostatic disruption. So they target different areas of our body, and among them can be like lipids or proteins. So on the picture on the right, I have an example of putting this into like an easier way of understanding. So our body is made of many atoms. So here I have a picture of a healthy atom and then a free radical. So kind of think of the free radical of kind of like a bully trying to take the healthy atom's lunch money. And then here we have an antioxidant trying to give back the healthy atom his lunch money. So that's just kind of, you can kind of like see it, put it in perspective of how these free radicals can affect our body. So then how can free radicals damage our body? There are different ways that free radicals can damage our body, and this is through cellular damage. And this is done by when the free radical tries to take the healthy atom's electron, and they can interact with different parts of our body, such as our DNA, our proteins, our fats, and they can disrupt the structure and overall the function of the cells. Then we have DNA damage. Protein damage. Proteins are essential for the structure and function of our cells and tissues. So free radicals can modify the proteins by, again, taking their electrons and trying to modify it, as well as inflammation. So free radicals can also activate inflammatory pathways in the body, and this can lead to chronic inflammation. So prolonged inflammation can also contribute to tissue damage, and that is often associated with development of numerous diseases such as arthritis or heart disease and even cancer. And then there's also aging. So if the accumulation of these oxidative stresses can cause damage over time, and that's believed to contribute to the aging process. So oxidative stress can accelerate cellular aging by damaging the DNA and the proteins. So here on the picture on the left, I have different ways that the formation of free radicals can affect us. It's through UV light, inflammation, even smoking, oftentimes air pollution. That's a number one risk for, causing us to damage our cells, and us as well as some radiation. All of these factors can lead to DNA damage. But what are antioxidants? So antioxidants are molecules that fight the free radicals in our body. So again, tying it back to that picture that we saw earlier, the antioxidant trying to give back the healthy atom his lunch money from the free radical. So antioxidants are compounds that can help prevent or slow down the damage to our cells that are caused by these free radicals. And this is why it's important to consume a diet rich of antioxidants from different sources, and why oftentimes a lot of people take vitamins. It's to, again, promote these antioxidants so we can prevent the oxidative stress and then the damage to our cells. There are different types of antioxidants. There's a diverse group of compounds. They can be classified to different categories. The most commonly one is vitamins. So certain vitamins can serve as antioxidants in the body. This can include vitamin C, which is the most commonly, I feel like everyone always takes this one, also known as ascorbic acid, vitamin E, and vitamin A, which is also known as beta carotene and retinol. There's also minerals. So some minerals can act as antioxidants, and they're required for the function of the antioxidant enzymes. And there's also photochemicals. These are naturally found in plants. So usually most often, people say to try to consume as much of healthy green vegetables. It's usually because they contain a lot of antioxidants. There's also enzymes and carotenoids, which is a class of pigments found in plants and algae and some bacteria. And then there's also coenzyme Q10, which is a compound that's found in every cell of our body, and it's involved in energy production. So this also possesses a type of antioxidant properties, and it helps protect our cells from this oxidative damage. So I just want to take a brief moment and kind of just have you guys ponder on what do all of these vitamins have in common. Most often I see people carry a bunch of bottles of vitamins because they want to have like antioxidants within their diet. But I don't think many realize that sometimes a lot of these types of vitamins contain multiple of the same ingredient. So for example, all of these vitamins contain a D3. So I think it's just important to kind of keep in mind that you don't want to always repeat the type of vitamin in these supplements, which I'll get into in the next few slides on the reasoning behind that. And just to also explain how you can be more aware of this by reading the label on the back of the vitamins. So here's an example. So just like foods that we consume, if you go to the supermarket and you pick up like some chips, they have like nutrition facts. Just like foods, vitamins do have a similar label. Instead, they're called supplement facts. So I just kind of want to help and orientate everyone of how you can read these labels. So usually it'll tell you like a serving size. So that's number 2 here. So sometimes it's kind of important to, if you want to get like the most benefit from these vitamins, to make sure that you're taking the correct amount of tablets or gummies or whatever form of vitamin it is. So, just keeping in mind the serving size. There's also an explanation of the amount of per serving. So how much of the vitamin does this type of product contain? And also the percentage of the daily value. So daily value, you can kind of connect it to like when you're eating like a chip or a cookie, they have like daily value and like based off of the 2000 daily caloric intake, it's kind of similar. So, again, just keeping in mind when you're picking up a supplement, taking a look at the daily value, you can kind of see like how much of that vitamin does this product contain. So for example, if you take a look at vitamin C, so this product contains 250 milligrams of vitamin C, but for your daily intake overall, it's 270%. So I think it's kind of good to just become more familiar with reading the labels and also taking a look at the ingredients, because just like when you're going to the supermarket and you're looking at the nutritional facts, looking at the ingredients for vitamins is also important, because whatever is the first 2 or the 3 first ingredients within the product, it's how much that product contains of that specific ingredient. So again, for example, if you go to the supermarket and you see sugar and corn as the first 2 ingredients, that's what that product majority consists of. So just keeping in mind when you're picking up a supplement to kind of avoid those artificial colorings and any of like those filler words that you're not too familiar with. So also want to talk about like how to safely take these vitamins. But it's also important to keep in mind that depending on your circumstance, talking to your healthcare provider, they may recommend that you take more than the recommended value for these nutrients. So for example, people who have vitamin D deficiencies, they're often treated with like the high dose vitamin D supplements. So for example, the supplements that for example, like vitamin D, the 50,000 international units of the vitamin D, these are well over the upper limit. But again, just making sure that you speak to your healthcare provider and just having that open dialogue with them. But I have this table here to kind of give you an idea of how much intake of the vitamins that you should be getting, depending if you're female and male. Some vitamins don't have a recommended upper limit. So it just hasn't been studied or established. But, for example, like vitamin A, for an adult woman, it's about 700 micrograms, and the upper limit would be 3,000. So that's just an example. I also want to talk about choosing a vitamin brand because oftentimes I get asked which vitamin brand is better, and I don't really think it's in terms of which vitamin is better. I think it's just in terms of which vitamin is undergoing the most testing. So, for example, vitamins are not FDA regulated, but vitamin companies do need to follow the FDA labeling. So I tend to look for vitamins that have like the following. They are USP pharmacopoeia like certified, and that just demonstrates that the product in itself is of quality, or those who have the seal of GMP, so good manufacturing practices. This company ensures that the vitamin that you are buying is what it says that it is, the strength, and it's pure. And some vitamins, I think, for example, if you look into like CVS vitamins, sometimes some of them say that they go through third-party testing, and this just means that the company voluntarily goes under additional testing in addition to being USP or GMP. And that just ensures that the vitamin in itself is pure and it says what it is. So, in addition to all of that, I just think it depends on what you're looking for, not necessarily the brand in itself. So, I know that vitamins and antioxidants go in hand, but sometimes more isn't always better. So as research has progressed, it has been evident that antioxidants in higher doses are not always beneficial. So for example, vitamin E supplements, they can increase risk of, reducing the blood's ability to clot. And also, especially after an injury, sometimes these vitamins also interact with certain medications, such as anticoagulants or antiplatelet medications that some people are often prescribed. And as well as vitamin C. I know sometimes, people get sick, they're like, I'm just going to chug a bunch of vitamin C and I'll feel better. But sometimes doing that can also cause diarrhea or nausea or, stomach cramps. And vitamin A can also cause severe headache, blurred vision, muscle aches. Vitamin D, constipation is one of the biggest side effects when you're consuming too much of it, and tiredness and irritability. So just keeping an eye out for not taking, again, too many of these vitamins. And a combination of antioxidants may also have some undesirable effects. For example, in one study, a combination of vitamin E, vitamin C, psyllium, and beta carotene reduced the cholesterol lowering effects of two medications that a patient was taking. So again, just keeping in mind that some of these vitamins can interact with the medications that you're taking, and it's always important to discuss this with your physician or a pharmacist. So I also want to talk about skincare products, since I know people often think antioxidants with skincare. So skincare and anti-aging. So for example, vitamin C can protect the skin from environmental stresses such as pollution and UV radiation. So if you can think back to that one photo, UV radiation was one of the common free radical formations that can lead to oxidative stress and then cause cell damage. And another good way to prevent like the free radicals from forming and just along with the anti-aging is sunscreen. So the way that sunscreen functions is that it primarily shields the skin from the UV radiation, and it indirectly prevents the formation of the free radicals. And this again helps by reducing the damage of the skin and then contributing to the anti-aging benefits. And the SPF recommendation is usually 30. and to reapply when you're doing any extenuous activities, or if you're swimming, it's always important to always reapply the sunscreen. And another one is retinoids. They are multifaceted role in skincare. They not only address the visible signs of aging, but then they can also be essential for helping with the damage too. However, when you're using retinoids in your skincare, it's important to introduce it like slowly, because sometimes it can be very drying. And it's also important to include wearing a sunscreen because your skin will become much more sensitive to the sun. So just keeping all of those things in mind when you're trying out some of these skincare products to help with the anti-aging. I also want to talk about some true or false statements. Most often, I feel like these are some of the common questions that I've also seen, heard, and been asked. So, can antioxidants reverse the effects of aging? So, depending of, remembering back about what I've been talking about, the answer to this is true. So antioxidants can help with, the the progressive of the anti-aging, but it cannot reverse the aging process completely. It can just help prevent and reduce the process. Another question that I've been asked and been told is, can antioxidants prevent or cure all diseases? But as we know, the answer to this is false. Antioxidants can play a role in reducing the risk of certain diseases by, again, combating the oxidative stress, but they're not the sole answer to all of the health problems, especially because if you take too much of certain vitamin, it can lead to the side effects that I've mentioned previously. And true or false, are all antioxidants equally effective? And the answer to this is false. Different antioxidants have different degrees of how they work and how they target different parts of the body. So it really just depends on the antioxidant itself. And to mention that I know that I majority spoke about vitamins. I didn't really speak that much about food and fruits. But another good way to have some antioxidant intake is by having like vegetables such as kale, very like green leafy greens, or blueberries, raspberries. All of these contain like high antioxidants. And in summary, antioxidants are molecules that neutralize the free radicals. And, again, tying it back to that photo of the antioxidant trying to give back the healthy atom his lunch money, trying to, prevent the free radical from being harmful. And then in some cases, it's extremely rare, but it can happen. If you're taking too much of the vitamins, it can lead to fatal complications. Vitamins usually have like a set established upper limit of normal. Again, it's just important to have an open conversation with your healthcare provider, because again, sometimes you might require more like higher doses of these types of vitamins. And that concludes my presentation. Thank you for listening and joining. Does anyone have any questions?
Thank you, Karen. There are a few questions that have come in, and I'm going to ask everyone on the Zoom, if you have any other questions, please go ahead and type them into the Q&A button area, and we will see what we can do as far as getting through the questions. So question number one, going back to the beginning of your presentation about free radicals. Where do free radicals originate?
Free radicals originate, well, it's from our different, so here, I'll go back actually. I spoke about it in terms of the formation. It can, So here, I didn't want to, it's kind of hard to explain it in layman's terms because it occurs like through like organic chemistry. So I wasn't sure like how to really clearly explain it,
Sure.
but it can come from like external our environment. So through pollution, UV radiation, this causes like the free radicals. So from happening. It causes the free radical from appearing, and then that's I'm not, I'm sorry, I'm not entirely sure how to explain it without getting into sciencey.
Sure. Yeah,
Um,
no, I completely understand.
yeah, but in retrospect, it's about like our environmental uh exposure to, pollution and radiation, and this can then cause oxidative stress, which leads to the free radicals from forming and then causing it from trying to take electrons within our body. And that's how like the whole oxidative stress occurs and then leading to the DNA damage.
Great. Okay. Okay, next question. Is there anything you can put on that can help wrinkles, especially around the mouth, without getting like Botox injections and that sort of thing?
Yeah, like retinoids, like I mentioned, retinoids at night is most commonly, so I even use a retinoid at night. So, after you cleanse your face, you can put a retinoid here around your mouth. I wouldn't put it anywhere near your eyes though, because that if it gets in your eyes, it will burn. But again, just gradually introduce the retinoid. I always apply it at night, and then in the next day in the morning, I always just put a sunscreen just to prevent my skin from getting dry, and then also because the retinoid will make your skin more sensitive to the sun, and we want to prevent that from happening. So retinoid, you can also use a vitamin C product. You can use that in the morning, like right underneath your moisturizer. And if you do want to use a vitamin C product, I would recommend one that is usually in an amber bottle because it prevents the vitamin C from breaking down.
Ah, okay. Thank you. Okay, and the next question, what is a good type of doctor to help you decide on what vitamins to take and how much?
What kind of doctor?
Yes.
That's a good question, actually. Usually, I maybe it depends. Like, if do you is there like a specific is it a specific disease state that you're thinking of? Like, let's say, like if it has to do with like heart, like cardiovascular. If it's cardiovascular, then I would think more of a physician who specializes in cardiovascular, who has a cardiovascular background. But usually, I would mainly talk to someone like maybe a pharmacist, but you said doctor, so maybe your internal medicine, like your primary care physician. I think it really depends on what you're trying to focus on. Like if it's cardiology, then I would speak to my cardiologist. That's just an example.
Got it. Thank you. And is it best to use supplements such as Centrum Silver for senior citizens?
Yeah, actually, that's a pretty good one because usually they usually will have like all the vitamins that is essential for especially at that age. So that's a really good one. I also included it in the photo, so that's just a good one. Again, just make sure that you're looking at if you want a specific amount of vitamins, just make sure that you're looking at the daily value, because sometimes you might need additional vitamins, additional supplementation to that vitamin, if that makes sense.
It does. Thank you. And then can you get antioxidants in food or do you need to take vitamins? I think you mentioned this.
Yeah, no, so you can get antioxidants in food. You don't have like so I know a lot of people don't like to have like swallow like vitamins or pills. But there are and the foods that have antioxidants, and these are raspberries, blueberries. If you like salads, like very green leafy greens like kale, spinach, goji berries, those type of fruits are the ones that have like high antioxidants.
Okay. And then are multiple products necessary for skincare, like, serums and all these other things that are out there now?
I think it truly depends on a couple of factors. I think it depends on your age and specifically like what you want to focus on. Like, is it wrinkles? Is it um, dark spots, like age spots. So depending on those, and what you're looking to target, the answer could be yes, and the answer could also be no.
Okay. And then what amount of vitamin D should we not exceed per day? Like what's the max that person should be taking?
So here in this picture here, like for example, the vitamin D for a male, it would be 600, and for a female, it would be about the same. But for exceeding, it's 4,000. So unless you, of course, are vitamin D deficient, but your doctor will probably mention that to you and then probably give you a prescription for the vitamin D. Usually the vitamin D, I always see everyone on the vitamin D3 because that one is the active ingredient, not the vitamin D2.
Okay. Okay. And then what kind of sunscreen do you recommend? Mineral or any specific kind?
The brand that I specifically use is Neutrogena. I I know there's like two different kinds. There's chemical and there's mineral. Again, I think it depends on you, and if you want something that's more natural or something that isn't as natural. I prefer the Neutrogena one just because it doesn't break me out, and it's always been trusted. I always feel like that one's like always the go-to. Everyone I know always uses that one too.
Right. And then is there a guideline for supplements or foods so you don't overdo a specific vitamin or, that sort of thing? Is there like a cap?
In terms of like a resource for someone to kind of look and see and familiarize themselves, is that what you mean? Is
I
that
guess so it seems like the person's asking like so you don't overdose, like if you're not giving yourself more than what you really should have. Like is there I mean, I guess this is your list here kind of goes over what the recommendations are for
Mhm.
adult men and women. But
Yes.
I guess this would be your guideline then,
Yeah.
right here.
Yeah. Um, there are multiple resources, so I don't think there's an established like a specific one. But there are multiple resources. You can look at various like health resources, like pharmacist resources. Like this is generally the amount that you kind of don't want to exceed. But again, it kind of depends on your age, and again, if you have any like health issues.
Got it. And how effective are skin, nail, and hair vitamins?
So I know a lot of people always use those, but they're not really as effective. Uh, Studies have shown that it's just better to have supplement like with actual vitamins and eating like healthier like foods that have antioxidants and foods that have like biotin. But if you look or you Google or look up a study, they don't really show like as much as effect. It also depends on like the person's genetic makeup too. Some people, grow hair faster, grow nails slower. I even when I took biotin, I didn't see a difference.
Hmm.
I think genetics kind of play a role in that as well.
Okay. And then how about probiotics? Do you think they're necessary? Is that something that people should be like actively looking into?
It can be very useful for some people, but I'm not sure if people also know that you can also get the probiotics from yogurt. If you like
Mhm.
yogurts, it has the healthy gut bacteria. So that's another way you can supplement into your diet. But if you don't really are crazy about yogurt or like that taste, you can supplement a probiotic and it's still useful.
Great. And what is the difference between vitamin D and D3?
So vitamin D3 is cholecalciferol, which is the active ingredient. So when you're like, I don't know if everyone has heard this, but like when you're outside in the sun, they always say like, oh, stand outside so you can get vitamin D. It's because our body can, it converts vitamin D. How do I say this? The rays that the sun produces with our skin, it causes like it changes vitamin D2 into vitamin D3. So vitamin D3 is the active ingredient, whereas D2 is not. It's not the active ingredient. So I'm sure what I'm trying to say is that vitamin 3 is the better one because it's active already and your body is going to actively absorb it compared to vitamin D2.
Okay. And is it true that some vitamins are fat soluble, which can accumulate and become toxic if overused?
Yes, that is correct. So that's like your vitamin A, K, E. Those are like the more fat soluble vitamins. So it's always you always have to be a little bit wary with those compared to your um, water soluble vitamins.
Okay. And I just see like one more question here. So if anyone has any other lingering questions, please get them into the Q&A. Um, do you have any suggestions for fragrance-free sunscreen?
Fragrance free. Well, I'm not sure if the person who's asking this has looked into Neutrogena, but
Mhm.
I mention that one often because it's usually made for sensitive skin and it's usually fragrance free. Like they have different products. So if you want something that is for sensitive skin and fragrance free, you can look at their line. They have multiple products.
Great. And I think that's it. We have a few people who just wanted to say, and excellent workshop and thanking you for answering questions and that sort of thing. So I also want to thank you, Karen, for taking time tonight to present to the community on this topic.